ready for microphone.
Good morning, everybody. This is Dr. Gail Newel, Health Officer for the County of Santa Cruz. And we don't have weekly scheduled press conferences anymore, but there's a number of interesting developments in our COVID-19 response that we wanted to share. So we're calling this press conference today for that reason. First of all, as usual, I'll go over our data dashboard, some of our highlights of our case data. And we've had quite a jump in the last few days in cases. Over the weekend, in a 2-day time period, we had 28 new cases. This is by far the greatest increase that we've had to date in COVID-19 in our county. We actually had to redesign our epidemiologic graph on the data dashboard to accommodate numbers of that size, and you may see further adjustments in the future. I want to remind people that even though this is a significant increase in our case rate, this is not a surprise. This is exactly what we've been expecting with reopening, with the political protests and our community memorials and vigils. And so not surprising, but something we want to keep a very close eye on, and a very good reminder that we need to continue to work as individuals, as families, and as a community to protect our beloved Santa Cruz County. So today we have a total number of known cases of 337 in Santa Cruz County. There are 106 active known cases. This is a significant increase. Just 2 weeks ago, we were down at around 40. So we definitely have more active COVID in our community. You'll also notice on today's updated data dashboard that we now have 3 deaths. And I want to tell you a little bit about that third death. Of course, we are very sorry and want to express our sympathies to the patient's family and friends. The death was not caused by COVID-19, but COVID-19 was a contributing factor to the death. And a little bit about the person who was impacted, the person who died, our third death. He was a male in his mid-90s with several underlying health conditions. He was undergoing hospice care, so he was at the end of his life at the time that he got COVID-19. The method of transmission is still under investigation, but likely from a close contact, person-to-person spread, likely either from a caregiver in the home or from a family member in the home. His area of residence was in the mid-county, and his date of death was July 15th. So June 15th. So this was relatively, it's been a while, but we're still working on investigating the case contacts and the mode of spread. If you look also back at the data dashboard, you'll see that we continue to have an increasing trend in demographics and geographics of South County cases, and most of our new cases, as has been the case in the past month, are in the Latinx population in the Watsonville area. So we're seeing not only in the county of Santa Cruz, but throughout the state and across the nation, a disproportionate infection rate among our communities of color. And as usual, you can look at our data dashboard for distribution by age, by profession, by gender, and by means of transmission. A reminder to the community that almost all of our cases that we're seeing are person-to-person spread. So they're not just from people casually out in the community, they're from a known contact. So this confirms what we believe to be true, is that almost all COVID-19 transmission in our community and across the state and the nation are when people are within 6 feet for a prolonged period of time not wearing face coverings. You'll also see that our total number of test results is increasing on a daily basis, and you can follow that daily along with the other data. And that we're also seeing some increased hospitalization, and our hospital census has gone up slightly, but we are nowhere near capacity at this point, so that's very good news. Again, I want to emphasize that the big jump in cases is something to watch, but not unexpected. I want to talk a little bit about new shelter-in-place orders that were released yesterday. So I've modified my health officer orders yet again, and effective today at midnight, the beach closure will end. So that's big news. We had hoped to continue the beach closure until after the 4th of July weekend, but it's become impossible for law enforcement to continue to enforce that closure, and people are not willing to be governed anymore in that regard, and so we want to recognize that by removing that restriction. The current shelter-in-place order extends through July 6th, after which it will expire on its own, and we don't intend to have a local shelter-in-place order anymore after July 6th. So we will be fully aligned and fully reliant on the state's order. The exceptions are that we do have a local face covering order and several other local orders that are specific to entities such as skilled nursing facilities. The new health officer order around face coverings and social distancing will remain in place indefinitely. This order aligns more completely with the state's recent guidance on face covering and includes some specific language around exemptions that should provide a better ability for businesses to avoid the back and forth with individuals over doctors' recommendations, etc. A big change in the face covering guidance is that face coverings for children over the age of 2 are no longer optional. They are now required. This may seem stringent and difficult, but it has proven to be manageable in countries around the world, and we believe that we can work with our children to safely wear face coverings when out and about in public situations. I hopefully don't need to say this again to our press colleagues that are in attendance today, but just a reminder again, the most important ways to stay safe and healthy in our community are to wash your hands frequently, wear a face covering when out and about, cough or sneeze into your arm or otherwise cover your cough or sneeze, stay home when you're sick, and keep at least 6 feet between yourself and others whenever possible. And I think at this point we can go to questions.
Sure. You want to start, Kara?
Sure. I'm just looking at the data and I see that the largest age group is 18 to 34. And we know a lot of the transmission happens person to person. Is there anything you can sort of extrapolate from that?
Well, that's a great question, and I hope everybody heard it, but Carol was commenting on the data that it shows an increase in people ages 18 to 34. And this is a trend that we're seeing in California, throughout the state and across the nation, because younger people feel less vulnerable to the virus, and they're the ones who are generally out and about more often. But by not protecting themselves and not being safe and following the social distancing requirements, they're putting their other household members at risk and other community members at risk. So the reason we're asking people to stay 6 feet apart, to wear face coverings, is to save the lives of our community members who are more vulnerable. And in addition to the social distancing requirements I've already talked about, I still am recommending strongly, more than ever, that people over the age of 65 and people with medical conditions or other conditions that make them especially vulnerable should stay home except when absolutely necessary.
Thank you. And if you're on the phone, I have a couple questions queued up. Text me if you want to ask a question. We're going to go first to Nick Ibarra from the Santa Cruz Sentinel. Nick, hit star 61 to unmute your phone.
Thanks, Jason. Hi, Dr. Newel. Thanks for doing this today. I'm wondering if you could comment on whether the contact tracing that we've done so far or anything else you know gives you reason to think that those protests and demonstrations that we've seen, especially 3 weeks ago, and those vigils and memorials you mentioned, were those a vector for spread of COVID? Do we know anything about that at this point?
We don't know that yet. The governor also messaged this yesterday or Monday on his weekly press conference. It's too early to tell yet about the political protests. We should just be beginning to see those cases show up now. And we haven't yet investigated our most recent cases. It's still underway. What we continue to see to date in our own county is family gatherings still seem to be the greatest cause of the clusters that we're seeing in most of our new cases. So we went from the Mother's Day gatherings that were the initial clusters to Memorial Day and graduation. So I don't think we've yet seen the impact from the protests and the memorials and vigils.
Thank you. We're going to go now to Jake Pierce from the Good Times. Jake, hit star 61 to unmute your phone.
Thanks, Jason. Hi, everyone. So I wanted to ask, since the person-to-person spread is still an issue, and especially with people contracting the virus via their households, what strategies are in place? Are there any strategies in place to stop the spread within households? And why haven't we heard more about how people can stop the spread that way?
Within a household unit, are you asking about?
Yeah, within a household unit. Yeah, thank you.
Yeah, so that would be pretty impossible unless we were to stay 6 feet apart from our loved ones with whom we live and not share bathrooms and not share bedrooms and not share other intimate activities, and including eating together. And I think that that's pretty impossible for a family unit to do. Viral transmission is very difficult to stop in situations like this within a household itself. We need to continue to do our activities of daily living. But if we can keep our interactions to just within our household unit, those kinds of interactions, then we can avoid spread throughout our community, because it's much easier to contain a cluster within a household unit where everyone is living together.
Thank you.
I'd like to ask about contact tracing. At the end of May, when the county opened up, parts of the economy, I thought we were at the place where we could trace within 3 days of infection, and now it seems like it's slipped further back, like it's been 10 days since that death, and we still don't know. I guess, can you tell us more about just sort of the status of contact tracing, how many days it now takes, especially given the recent bump?
I'm going to let Jen Herrera, our Chief of Public Health, talk a little bit about our operations and our plans to address the areas in which we're falling short.
So for contact tracing, we have a goal of being able to conduct the initial investigation within 24 hours. Right now, we are not meeting that goal, and we are triaging our cases by priority of risk based on how they're coming in. It does take a while for us to investigate cases and come to a conclusion based on our analysis of transmission and all of those details. Demographic details are obviously very easy to get, but for something like transmission, it takes a while for us to publicly come forth with a conclusion. So that's why there's partially, that contributes to the delay in the case that we discussed today. So we have had the really great fortune in this community of being able to have a lot of volunteers step up and people who have participated in an online training provided by the state for contact tracing. And where we're at right now is we are onboarding to a system called CalConnect. It's a state's provided platform, online platform, in order to expand contact tracing at the local level. It just happens that the onboarding and operating of that new program, that expansion, coincides with the effects of the reopening that has happened. So we have a rise in cases, and at this time we are transitioning to expand contact tracing. So the delay in our initial response is where we do have a delay at this time, but we are working on increasing our capacity so that that's not prolonged.
So does it have to do with CalConnect? Or tell me more about that initial response, that delay. What's that caused by?
It's caused by a surge in cases. So as Dr. Newel mentioned last time, a week or so ago, we were at 40 active cases, and now we're at 100. And we just haven't, we're still in process of operationalizing that contact tracing expansion. So due to the rapid rise in cases, which is on our data dashboard and in numbers, but also in the visual format on the epi curve, clearly we're at a point right now where we are trying to ramp up as quickly as possible in order to meet the rising need.
Sorry, I just wasn't clear. Is it getting people trained under that new system, or difficulties with the system, or just would adding more staff people help solve the problem?
So it's getting people trained onto the system. It's the logistics of transferring our old processes to this new system that's brand new for everyone in the state of California.
We have a question from the Aptos Times on whether graduation and graduation gatherings have been a factor in the increasing numbers.
Yes, they have.
Thank you. Another question from Nick Ibarra from the Sentinel.
Thanks. I'm wondering, part of what makes, I think, these numbers hard to understand is that we're increasing testing, we're seeing increasing cases, and I'm wondering, Dr. Newel, if you could help untangle that. Could you comment at all on what the rate of positive tests has been? Has it held steady? And what should that tell us about these increased case numbers that we're seeing as testing seems to have also increased?
Great question, and I want to make sure that it's really clear that the increase in cases identified is not due to increased testing. Our testing positivity rate remains very low, below 2%, which means we're doing adequate testing, and also means that we still have a very low community level of transmission in our community. But so the increased cases are not due to increased testing. And we know that because that positivity rate is holding steady. I do want to mention something specifically that it would be helpful to get out to the public around contact tracing. As we onboard onto the CalConnect platform. People will be getting phone calls where the caller ID says COVID CA for California. So COVID California, and it will come from an area code of either 916 or a 454 local number here. And it's very important that people answer the call and that the calls are confidential private calls. So if they see COVID CA on the caller ID, they need to answer. It's not spam, it's not recorded, it's not going to divulge any of their personal information. It's very important that we can get through to people.
Great, thank you. We have another question from Jake Pierce from the Good Times. Jake, are you there?
Yeah, I'm here. Yeah, thanks. Can you hear me?
Yep.
Good, great, thanks. Thanks so much for all the information today and for calling this press conference. When did you learn about the June 10th death, and why are we just hearing about it 10 days later?
It was a June 15 death, so not that long. It takes a while for the death certificate to get processed and for the attending physician to determine the cause of death. And once we got the death certificate, it was not clear whether this should be categorized as a COVID death or not, because COVID was not the cause of death. COVID was one of many contributing factors to this person who was very ill at the end of his life. And we went back and forth with the state on this for a number of days, and they do not yet have a definition that's clear on what a COVID death is. And in the end, we decided to go with the CDC best practices standard for our standard in the county of Santa Cruz, where we would call any death with either a cause or a contributing factor of COVID-19 as a COVID-19 death. So it was more a bureaucratic process of decision-making about how to categorize deaths like this.
Okay, that's interesting. Thank you.
Thank you. We're gonna go next to Tony from the Pajaronian. Tony, hit star 61 to unmute your phone. Tony, are you there? We can't hear you. There you go.
Okay, can everyone hear? Sorry.
Yep, you're good to go.
Okay. Thank you for holding this press conference. I wanted to follow up on a question that I believe Nick Ibarra, I can't remember who asked it, about the spread and the spread within households. Dr. Newel, you said that the spread and the COVID clusters throughout the county have been caused by person-to-person spread in the household and through gathering. Do you have more details as to where, or have you guys been able to trace back the origins of the initial case that caused those clusters, whether it was happening at work, especially here in South County, if the person who brought COVID into those family gatherings caught it at work, or maybe it was just community acquired, and you guys haven't been able to trace back the origin of those cases? Thank you.
Yes, when we look at our cases, very rarely are the cases acquired in a work setting, in the professional setting itself. Some of the cases are acquired in the break room at work when people gather closely together and take their face coverings off to eat and drink, and are often too close to other employees. So it's more those social gatherings outside of the household units that are putting the greatest number of people at risk. So gatherings across household units, multi-household units, gatherings casually in the work setting, but not the professional setting per se, so in the break room or outside in the parking lot. That's where it seems that people are not physically distancing, not wearing their face coverings, and being too close to each other. And as 4th of July is coming up and we're planning to celebrate together, we want to remind everybody that if you do choose to gather, which is still not our recommendation, but if you're going to gather outside of your household, that there's safer ways to do that. So we're starting to use more harm reduction messaging, that if you are going to gather, try to do it in ways that minimize your contact with others. Keep your visits short. Keep your face coverings on whenever possible. Stay 6 feet apart whenever possible. It's better to gather outdoors than indoors. If you're going to do fireworks, do them in your own home or perhaps in the street of your neighborhood, staying socially distant. Wash your hands often, continue to do that. Gather with as few people as possible. As I mentioned, it's safer outdoors than indoors. It's safer to be active together outdoors than to sit together outdoors. And it's always good to clean and disinfect commonly touched surfaces. Don't share utensils, equipment, etc. Don't share sports equipment. And if you're going to eat together, if people can bring their own food and not potluck, that's probably helpful as well.
Thank you. We're next going to go to Paul Rogers from the Mercury News. Paul, hit star 61 to unmute your phone.
Hello, thanks, Dr. Newell. 2 quick questions. On the beaches, do you know if Santa Cruz County was the last county in the state to still have closed beaches, or if there are any other places that still have closed beaches? And then second, on the practical impacts of lifting the shelter-in-place order, I'd love to hear a little bit more about what will be different after it's lifted than before. You just mentioned sports equipment, for example. So would youth sports be allowed again? Will the boardwalk be allowed to open? What are the practical impacts of that? Thank you.
Thanks. So we're going to be aligning completely with the state guidance from here on out. The governor has not released guidance on youth sports or adult sports at this time. He has promised to do so shortly about youth sports. I would anticipate that becoming clearer after the 4th of July weekend prior to schools opening, so that school athletics can resume to at least some extent. I know that youth sports are one of the top priorities to release guidance in the near future. As far as big tourism activities such as the boardwalk, I'm not going to make any guesses about when the governor might allow something like that because I've been wrong so many times before and surprised so many times before about the reopenings and the schedule of the reopening. I know that Disneyland decided to delay their reopening, and I think that's an indication that they are responding responsibly to our state's increase in cases. So perhaps our boardwalk will follow the same lead.
On the beaches?
Probably the last.
Are we at the last? Many of the state parks are still closed by their own decision at the state level, which the local health officers don't have control over. But you're correct. As far as I know, we were the last county to have a local restriction on the beaches.
Thank you.
Next, we'll have Erica Mahoney from KAZU. Erica, if you can hit star 61 to unmute your phone.
Hi there, thanks for holding this. I have 2 questions. So now that the beach restrictions are lifted, does that mean you can go anytime and you can sunbathe and sit on the beach, or are those restrictions still in place?
Starting tomorrow, those restrictions are no longer in place. The state parks may still have some restrictions in place, and local jurisdictions, the city beaches may also have their own, but from a county point of view, that is all lifted.
Okay. And then my second question is, yesterday Newsom rejected calls to halt the state's reopening, but just given the context of a surge in cases and we're seeing businesses open, I was just curious about your take, Dr. Newel, about could there be restrictions in the future, or, it just seems like suddenly we're having this uptick, but we're opening, and I'm curious about your take on that.
Yeah, well, my take as a public health official, I'm always going to be biased toward the health and safety of individuals in our community. And I'm surprised by the speed of reopening and somewhat uncomfortable about it. I do think, however, that it's necessary from an economic point of view, and I understand that balance that the governor is trying to achieve. I do think that it's safe for most people to be out and about in their community in a responsible fashion. Again, I think people over 65 and those with medical conditions that make them vulnerable should stay home unless they absolutely need to leave. But for the majority of us, I think it's safe to be out and about for our needs if we're continuing to follow the social distancing requirements. And the governor has made that pretty clear in his press conferences. I mean, he has pleaded with people to wear their face coverings, to continue to be cautious in their movements. And I think if we are responsible and reasonable in our activities and the reopening, that we can, as a county, a local community, strike a really good balance between economic recovery and the impacts of this disease.
Do you have a question, Kara?
Yeah.
Thank you,
I
Erica.
have one more question. I guess this is for Jen. I know it takes a couple days to follow up to understand the results of contact tracing, but what do we know, what can you share about the initial results you're getting about this recent surge of cases since Saturday? Do you have a sense of if it's from case clusters again? And what more can you say about demographics?
At this point, we don't have anything more to say than what's listed on our data dashboard, which does include the basic demographics of our cases. We're at the point where we're still doing the initial investigations for many of the cases that came through over the weekend, and we hope to have more information in the coming weeks.
Thank you. Nick, do you have another question? Nick Ibarra?
Yeah, I do. Thank you. It's actually a two-parter. First, I just want to confirm that I'm not misreading some of the data here, Dr. Newel. And is it the case that 107 active cases is the highest number of active known cases we've had throughout this pandemic, and the 6 hospitalizations are the highest number of hospitalizations we've had, and Monday's single daily reported case total was the highest and more than double the single highest prior day? That's the first part. Are those 3 facts true?
Yes.
As far as you know?
Yes.
Okay, got it. And secondly, I'm wondering, you said that this wasn't a surprise to you per se, but I'm wondering, does the data that you've seen this week at all change the modeling for Santa Cruz County, or your own understanding and prediction of what is going to play out in the weeks and months ahead? And either way, what are you expecting to see happen in those weeks and months ahead? Thank you.
I'd refer you and the public to our modeling that's available following the data dashboard on our santacruzhealth.org website. It's very helpful and useful, and you can see the predicted hospitalization curve, for example, there. And I'm a little worried that it looks like we're going surging up on the higher end of that confidence interval. So we'll keep watching that. It's too early to tell. Of course, we're concerned about our hospital capacity and ventilator capacity, and we'll be watching all of that. But we're still a long ways from approaching any kind of trigger in that regard. We have been in conversations with the state around triggers, and on the California Department of Public Health website, you can see what some people fondly refer to as a watch list of the counties. All of the 58 counties are listed there with their data, and counties that the state is monitoring closely are flagged in red. Santa Cruz County has never been in a red zone. We did have our first meeting with the state today about the monitoring process, and we feel reassured that compared to the rest of the state, we're doing relatively well, actually very well compared with the rest of the state. But just a reminder that the counties that surround us all have much higher case rates than we do. And as tourism increases and our beaches open, we can expect that those counties' cases will impact our own.
Great. And then we have one more from Jake Pierce at the Good Times. Jake, are you still there?
Yes, I am. Thanks. Yes, so just one other detail I was curious about in terms of the recent COVID-19 death. Was the person diagnosed before or after the death?
It was after, wasn't it? We're trying to put our heads together here to remember. We were following him because he had close contacts that we had identified as positive already. But I don't think that he himself was diagnosed positive until after his death.
Jake, I'll ask you and I'll follow up with you.
Yes,
All right.
thanks. Yeah, that's a guess. I'm sorry.
No problem. Thank you.
Anything else? Anybody? Any more questions? Well, thank you all for coming. We're going to wrap it up. And like I said, we'll do these as needed going forward. And I think today we needed to do. Talk to you soon.
It was definitely before. I remember now.
Okay.
Yeah, he was diagnosed before.
But it was like, he was already on hospice at that time.
Oh, he's been on hospice for
Yeah.
weeks already before his death.